episode number 30 of the Treatment Room Secrets podcast. Super fun. We made it to the third floor, you said? I never thought about it in those terms, but we made it here to the third floor. This is episode 30, and we're going to talk today about something that I have preconceived notions about, some positive, some negative, but I just have opinions about based on what I've seen, based on what I've heard. But I'm very lucky to be in the studio here with Kimberly, California. So thank you for being here, Kim.
Thank you for having me.
Super exciting. See, just by the way you said your first sentence on the podcast, it sounds like you feel at home, and this is the stage for you to share the information that you have. I want to learn about Botox. And you said the ideal way that we could have done this is if I got Botox on Monday and then we walked in the studio today, which is a Saturday, and then to see the differences. Is that the process? A few days? I'm just trying to understand, why couldn't we have done Botox right here, right now?
So we could, just so you could get the experience of the injection portion of it, but the actual botulinum toxin, the product, takes time to kick in, so it's not an immediate effect. So if we had done it like on Monday, let's say, today it would have began the process of kicking in, so you would have noticed at least a little bit of the effects. And
do you, besides seeing the visual effects, do you feel any effects? Do you feel anything? No feelings.
No feeling. The only thing that you would feel is maybe when you go for the area that's treated. For example, like what we could have done would be like the forehead lines, the angry face.
The angry face.
Yeah, like when you go to make the face, it may have felt like a little like restrained, if anything, while it's kicking in. But no, otherwise you don't feel it at all. You really notice it starts to work because you look in the mirror and you're like, ooh, that looks nice. But do you feel the restriction after it kicks in? After you get used, like after it's there and it does its thing? No. So you don't feel it restricting in any way? No. Because that's where I think my preconceived notions come in. From is that when I say it, I mean, when I think of Botox, I think of the celebrities that maybe you'll tell me, but it seems like have done it too much or have done wrong or whatever it is. But it seems like their face is just, something's not okay. Their face doesn't match who they are, what age they are, the expressions they're making, the feelings they're having, and it does seem restricted. It seems like they're restricted, but you're saying that they don't, from their side, they don't feel what we see, what we think we see. Right, and that's also my favorite preconceived notion. Why? Is that people think that the celebrities that they see that look totally nuts are just like Botoxed out, and they're definitely not. They do way more than that. So what are they doing? I mean, a ton of stuff. Plastic surgery, a lot, overdoing fillers. They definitely have Botox for sure, but they have too much Botox, over treatment. Do you think Botox has a bad name, a bad connotation associated with it? I think there's a stigma. I think that where we are today is the less stigma that there has ever been, for sure. We've come a very, very, very long way in that world, for sure. Why? Like, what are some hurdles that the culture had to go through, let's say, to maybe be more accepting of it? So I think the biggest thing, and not just with Botox, but the aesthetic world in general. So like we're talking Botox fillers, plastic surgery, all of that stuff. I think in the last 5 years, but really 5 to 10 years has advanced so greatly. We're better at it. I think that a lot of the preconceived notions and the stigma against us getting work done in general has been from poor work from celebrities that are in the public eye back in the 90s and the early 2000s. I think they really, really, because that's kind of when this stuff, fun fact, Botox has only been legal for aesthetics for 25 years, I think. What are we, 2023? Yeah, since like the late 90s. And what was it used for before? Like medical purposes, migraines, things like that. They've even used it for like Bell's palsy, things like that. Neuropathic disorders. It was all medical purposes. So do you think, is that why there's this stigma maybe around it, is because it's seen as something that people use out of maybe like privilege and not necessity when we're looking at aesthetics?
That's probably part of it. That it's a some people think it's like a vain thing to do, you know.
Yeah.
Be receiving a treatment that's not necessary. It's only for aesthetic purposes.
Yeah.
I do think that's part of it. Yeah.
And the fact that, like you said, we're better at it. So like in the 90s, and when it started being legal, maybe aesthetically, did just more things go wrong because people were less experienced, the people administering it?
Yeah. And not so much go wrong as far as it would be more of making it look bad, overdoing it. And really when I'm talking about that, I'm talking about in general, because, you know, a lot of people, like we say Botox, it's more than that, you know. Plastic surgery and all that stuff really blew up in the 90s and the early 2000s, and a lot of the celebrities overdid it. You look at the older celebrities who have awful facelifts, too much Botox, too much filler. They look terrible, you know, but it's, we've moved past that now. And I think that this next generation of older celebrities, you know, people in the public eye specifically, are going to look a lot better and going to be better examples of the things that we can achieve in this field.
Have you ever seen the movie Christmas with the Cranks?
No, I've heard of it though.
But there's a funny scene there of Tim Allen. You know Tim Allen, the comedian?
Yes.
Buzz Lightyear. There's a scene there where he comes back from he's getting ready for a vacation, for a cruise, and he comes back with half his face like drooling because he got Botox or something.
So it's so funny you said that, because I think of this scene in Cinderella Story with Jennifer Coolidge. Iconic scene. She's in the car and she goes, and they're trying to talk to her, and Jennifer Coolidge, she's the mom, the wicked stepmom, and she's going, I can't move my face, I just got Botox, you know what I mean? And then she gets in a car accident and she's like, oh, I can move. And it's not like that, like at all. You know what I mean? Yeah. But when I watched that, when that movie came out 10 years ago, I would think that it was like that. It's not like you can't move. You're not like, you know what I mean?
Yeah. So it's different. It's still fairly new in our culture. If it's only been legal for 25 years, 25 years isn't that long. So when we were all kids,
exactly. It wasn't legal. Well, if you think of it in generational standpoint, my mom, I like to use her as an example, started using it for aesthetic purposes when it first became legal. So she's only been getting it for 25 years, but 25 years ago she was 40.
Yeah.
So it's like a lot of that generation has only been using it since they were 40, versus now our generation, I've been using it since I was 22. Yeah. So yeah, it's relatively new to a lot. And
is there an advantage because if you are on this journey of being administered Botox, and we'll talk about maybe the different reasons to why you want to do that, but is there an advantage to starting early? Like if you started at 22 versus starting at 40 like your mom?
Yes, so my favorite thing
when looking at the 60-year-old or the 70-year-old.
Correct. So preventative Botox is very much a thing.
Preventative Botox.
Yes.
And what does that mean?
So preventative Botox would be okay. Quick, I'm gonna do a little not a science spiel, but just really quickly.
The more, the better.
So there's the most common areas of the face treated would be here, and here. Okay.
Here, meaning for the people that are not watching. So between the eyebrows.
Yes, between the eyebrows.
Yeah.
Okay. Would be the forehead, which is just above.
Forehead between the eyebrows.
Between the eyebrows is glabella. The forehead, the frontalis muscle, and then the crow's feet. These are the three most common areas. Okay. So let's say until you're 40 years old, you're making expressions. Everybody makes expressions.
Yeah.
No matter what, it doesn't matter. Babies have these lines.
Yeah.
You look at a baby, I'm telling you now, you're going to notice, because I told you, everybody has these lines. So, for everybody who started Botox at 40, which is a very common thing, a lot of people don't start until they're 40. They have been making those facial expressions in their face for 40 years, So what happens to the skin, the dermal layer of the skin, is it makes creases. Okay, so we end up with what we call static lines. Okay, so there are lines that are there all the time at rest. I'm just sitting here and I have lines in my face. Wrinkles, rhytids, wrinkles. So once you get to that point, then it's very hard to get rid of those wrinkles, even with Botox. The Botox helps, but it's hard to get rid of those wrinkles totally.
Yeah.
You know, so the idea behind preventative Botox is if I start at, now 22 is a young age. People like to say 25 is a good age to start. I got into the field really early, so I started early.
Yeah.
Starting
so let
earlier.
let me ask you, pause you on that. So, but why 25? Why is that the threshold?
Honestly, there's no like science behind that. I think that's just like a general consensus for a lot of people. If you ask me, I'm going to say 21. I like early. But yeah, they say 25 is when you start to see more and more deep set lines in the areas that you have expressions would be 25. So when you start to see the finer lines. So let's say you start before those lines start coming in, you actually
That's what the preventative comes in.
Exactly.
Yeah.
So, you know, I have not been moving my forehead that much because I've been treated for Botox for many years. So in 15 years, I'm not going to have any lines on my forehead. I'm not going to have to worry about those etched deep lines in the dermal layer of my skin because I've been semi-paralyzing the muscle movement and the expressions for that long.
Yeah.
If that makes
So
sense.
so is that what's going on? So if we take, you said the frontalis muscles, is that where the creases form on the forehead? So are you paralyzing the muscle slightly? How does is that the process of? Oh yeah, is that the process of the Botox? Is that what it does?
Right. So and when we say Botox too, it's botulinum toxin. So neurotoxin or neuromodulator. Botox is like the brand. So I work with different neurotoxins. There's 5 on the market, 5 different ones. So when you use botulinum toxin,
so Botox is like the Kleenex of neurotoxins.
Correct, exactly. It's the household name. It was the first one.
Okay, so I didn't know that.
Yeah, so
I'll stop giving them credit.
So so we like to use neurotoxin, especially because a lot of places work with more than one brand.
Yeah.
Like I work with Botox and Dysport. So we say neurotoxin, but the actual molecule is botulinum toxin.
Okay.
So what botulinum toxin does is it's a very concentrated, very, very small amount, and I inject it very precisely into the muscles that I'm treating, only into the muscles that I'm treating. So anatomically, I have to know exactly where I'm injecting. And then the toxin goes in and it works on the neuromuscular junction, which is the muscle and the nerve. They're like this, you know, and then it goes right in here and it blocks the acetylcholine release. So basically the contact between the nerve and the muscle, which is what makes the muscle move.
So I'm going to go for the short version, the Botox.
Yes.
It blocks the connection between the nerve and the muscle.
Correct. But only in very specific, precise areas that I place the product.
I see. But does any muscle in the body have that? Like, I get that you wouldn't aesthetically inject every muscle in the body, but hypothetically, could you do that to every muscle in the body, separated from the nerve?
Yes. And it's not a separation. It's just the neurotransmitter release is blocked. I could do it anywhere in the body.
So the neurotransmitter is blocked.
Yes. It's the acetylcholine, which, you know, if we went into like the real science, I actually think
yeah. No, it's good stuff. The more we can explain it in simple terms to me, the better.
Yeah, I try to keep it simple. There's like a whole science behind it, but yeah.
Yeah, but what is the actual like, what are we injecting into the body? What is the toxin, the Botox? What is it?
It's a toxin.
So it's a toxin that has this effect on the neurotransmitters,
yes,
which will separate the nerve from the muscle, which will create the muscle. Like, without the nerve, the muscle just can't operate, or doesn't operate as well. Can you separate the nerve from the muscle in different degrees? Is there a spectrum to how you paralyze, for example, the frontalis muscles? So how do you work that nuance of how much are we going to paralyze the muscles?
So definitely product dependent, and then the product insertion, the application of the product is very precise. So let's say, for example, the frontalis is a pretty big muscle. It goes like this, you know, it's large.
Yeah.
If I can do just up here, and half of the frontalis is gonna work. The bottom half of the frontalis is gonna work. because it's a bunch of different nerve fiber, a bunch of different muscle fibers. So it does its best to work, So if I'm really just going up here, then I'm only getting up here. And that really is like a telltale to the safety and the precision of the product, because a lot of people are like, what is this going to do to my brain? You're so close to my brain, like silly things like that. But really, it's so precise and such a little amount that I can put it just exactly where I want it.
Can the process be reversed, or does it die out over time?
Yes.
So what happens? I come in for my my frontalis Botox session, and you inject in different places because it's a big muscle. So how often do I have to come back after a certain amount of time? Do I have to come for a few sessions before we take a break from each other? Or for some people, is one session enough? Or how does that work?
So the product naturally metabolizes. Your body just gets rid of it in 90 days. So you cleanse yourself out of it organically almost, and then you go right back to normal, right back to baseline where you were before. It's like it never happened. Yeah,
that's so interesting. So even someone, let's say, so I'm assuming this will take a longer detox for someone, literally detox, right? But if someone does Botox for 20 years, let's say, and then they just stop. So however long that period takes, but after that, whatever amount of time that is, that all those toxins will leave their body.
Yes.
And so that's one element of it, the toxins leaving the body. Now, the second element is, so I'm doing Botox on my forehead for 20 years. What happens to after those toxins leave my body, when I decided to stop getting my Botox administered? So what happens to the skin on my forehead? Like, do the lines just come back because now I'm activating those muscles?
Correct. So let's say right now I've been doing Botox since 22 to 42. Let's say I'm 42 now, and I have not a line on my face. It's beautiful, and then I'm like, I think I'm done. I'm not going to do Botox anymore.
Yeah.
My muscles will just go right back to working again, like they did 20 years ago, or however the last time, and I probably in another few years, like 5 to 10 years, I'll start to get those wrinkles. You know what I mean?
Okay, because you're allowing your body now to kind of recreate them.
Because I'm allowing my body to recreate them, right? So it's like once it goes away, the great thing about this product is that a lot of people get worried if they do it one time that they have to keep up with it for forever and ever, and you don't. Like you do have to keep up with it if you like what it looks like, because it goes away, but you go right back to baseline. It's just like it's all gone.
Someone walks into your clinic, and how does it usually go? Do I walk in and I say, hey, I want Botox here? Or do I sit with you, we have a consultation, and you, based on analyzing, evaluating me, would recommend administering Botox in certain areas? How does it usually work?
So I had mentioned the 3 pretty standard areas to receive the Botox.
Which is the forehead area, right? Between the eyebrows and the
forehead, and then right next to the eyes, which we call the crow's feet. Yeah. Those are pretty much like universal areas.
Which is the eyes part? Like how? When you smile, it's on the sides of your eyes. Yeah.
Yeah. Those are like the most standard areas because those are the first signs of aging that people notice.
Notice and that are visible to the world.
Right, but there are many other areas to treat Botox that I recommend to people if I notice them,
Yeah.
But yeah, most people say, oh, I'm just here for, the standard upper face. And then we do the standard upper face, but some people will be like, nope, tell me what I need. Anywhere else you can put it, I want it. And I'm like, perfect, let's do everywhere. Yeah. And we'll do a bunch of other places. I mean, there's so many other places.
So what are you're saying there's so many, but what are maybe some common ones besides the eyes, the eyebrows, and the forehead? What are some common ones that people come in for?
So a really common one is the jaw. So these are the masseter muscles. Okay. A lot of people grind their teeth or have TMJ or hold tension. Okay. Yeah, hold tension. So we actually treat the masseter muscles. They're big, big, big muscles.
Yeah.
So it provides a lot of relief for TMJ and for grinding. It slims the face, so it's really nice aesthetically. It looks really nice. People love to do the chin too down here.
So is that also something that if someone does suffer from TMJ that they'll come in for every once in a while just to get that relaxation? So just by literally
slightly paralyzing the muscles, then it just provides that relief because they don't use those muscles as much. And
I have people who can't live without their masseter Botox.
and
It's everything.
teeth grinding is a huge issue, right?
Yeah, it's called bruxism. It's a medical. It's a real thing. It's debilitating for some people. They lose their teeth and stuff, and Botox in the masseters is the answer to it. Dentists recommend it all the time. Yeah.
Wow. That's so interesting. Okay, so that's one. That's a very interesting one.
So that's a good one.
See, that's already, and that alone, I think, helps change the stigma around. Again, I think maybe I'm that simple in my mind, but as soon as there's some like health attachment to it, or lifestyle attachment to it, it's just easier to swallow.
I'll give you a good one.
Going through an injection or going through a medical procedure.
Of course. So I get a lot of so men and women, but men especially
As one of my questions, how many men come in?
A lot. Yeah. Not anywhere near as much as women, but I get a ton of men who come just for the wrinkles alone. Like they don't like their wrinkles on their forehead, things like that, and their crow's feet wrinkles, the eye wrinkles. But a big thing for men is sweating. So a lot of men sweat here on the forehead, in between, and then on the nose and stuff like that, and then right here under the cheeks. And I do a technique with the Botox where I just sprinkle Botox everywhere, and it inhibits the sebaceous glands and the sweat glands, and you don't sweat.
On the face, though, specifically for the face, that is.
Yeah. Well, they do it I mean, the hands. Like people will do it on the hands as well.
Yeah. So if someone has sweaty hands, and we all know someone with sweaty hands. So you inject the Botox in areas of the hand muscles.
Yep. Mm-hmm.
And that prevents. So how does that work with what is the simple term science behind how paralyzing the muscles stops from the sweat glands from?
So it's honestly, the science behind that is a little less clear, because we know exactly what botulinum toxin does, and it's not 100% clear how it affects the sweat glands. But since the sweat glands are all in that area, we think that it's going in and doing essentially the same thing. It's just inhibiting them from working as well. Yeah. It's honestly something that they discovered from treating people with Botox. They're like, oh wait, now you're not sweating in that area. That's amazing. So now we use it for that. And it really started, they discovered that from up here in the forehead. People who have hyperhidrosis and flushing in their cheeks and their forehead, it's very common, very, very common. They found that after being treated for wrinkles, that there's no more sweat. It's just dry. It's really nice. And it shrinks your pores.
Very interesting. And then also under the armpit as well. Armpits. Does that have a under the armpits? Isn't that like the brain of the sweat glands across the body? Like, isn't that the main sweat gland condensation in the body?
Yes.
So by injecting there, you're not just preventing yourself from sweating in that area, but other areas of the body as well.
No. A lot of the time, people who get their armpits treated end up having compensatory sweating. So you sweat somewhere else. That's often a side effect of axillary armpit treatment. You just end up sweating like a little bit more, like let's say in the lower back or something, because it's a thing. It doesn't happen to everybody, but it is very much a thing. But it's true. It's because the sweat glands are so concentrated in the axilla that your body's confused. And it's like, well, wait, but people don't care, because some people have true hyperhidrosis, which is excessive sweating in the armpits, in the hands, in the face. It's a thing. Yeah.
The face I've never really heard of. Yeah, the face is an interesting one. What is the term for someone with excessive sweating?
Hyperhidrosis.
Hyperhidrosis. All right. So we said the sweating, the TMJ for the jaws, or the teeth.
Teeth grinding.
Bruxism. Bruxism. So what is another common one that people come in for? Is there like another maybe a health associated one, an injury associated one that provides people with that relief?
So a big health and injury associated one is migraines. So interestingly enough, I do treat a lot of people for migraines, but most people go to a neurologist to get treated with Botox for migraines.
So a neurologist will also treat someone with Botox?
Correct, because insurance. So it's less expensive. So you can actually get it covered by insurance through saying, I've had an injury and now I get really bad migraines, or hold a lot of tension, or I have a cervical injury, things like that. or just migraines in general. I've heard of people getting full treatment, Botox everywhere. And when I say everywhere for migraines, forehead, glabella, crow's feet, occipitals, which is the back of the head.
Yeah.
Trapezius is a big one. Paraspinal muscles right here. Mm-hmm. And then sometimes they'll do posterior trapezius.
Yeah.
If you're really holding tension. And then temporalis, which is like right here.
And by loosening up all these muscles, slightly paralyzing all these muscles, then it just provides that relief to the head, to the what is it, to the brain even, or the surrounding muscles of the brain.
Mm-hmm.
Is it something that people feel almost right away, the relief when it comes to migraine? Because I've never suffered from migraines, thank God, but it's a chronic thing. Usually when you hear about migraines, it's people that are suffering chronically from it. So is it something that they do feel almost an immediate relief from?
So I don't suffer from migraines either, but I would say based on the mechanism of action of Botox, no. They would wait for the product to kick in and then they would feel relief from the migraines. A lot of patients, especially for migraine treatment and for bruxism, the teeth grinding, they come religiously every 3 months, but sometimes they just wait until they start to feel symptoms again. Like, especially my teeth grinders, they really hold off. They go, oh, I feel myself grinding, until they come back in and get a full treatment, and then they're better in like a week, 2 weeks. So it's not like right away.
Just like you said in the beginning, like if I did it, we'd need a few days for it to kick in.
Correct.
But is there, so in those few days, what is happening? So we're injecting those toxins into those specific areas that we're pointing out in the body. So what's happening during that time when it's kicking in?
So
is it finding the neurotransmitters? It needs that time to.
It just needs time. So you absorb the product. The product is mixed with saline. I also brought everything. The product is mixed with saline because it's just a little powder, and then I mix it with saline, and then I administer it, and you resorb the product and resorb the water, and then the product is the botulinum toxin is there. It goes to where it needs to go to, and then it does its job. It just isn't immediate. It takes some time, But some people honestly start to feel the effects in like 24 hours. It's really quick.
Yeah.
It's just, it is sort of for your muscle to kind of relax. Your muscle obviously fights it. It's wondering what's happening. It gets all confused. So it kind of fights it. So for it to be completely, it's not a complete paralyzation, but to get to what we're aiming for, it can take up to 2 weeks.
Interesting. Cool. How did you get into this? Did it come from, you said 22 you went, you started doing Botox?
Yeah.
So my first question is, did you get into it after being in the profession, or were you introduced to it before you even stepped into the profession?
I think that I did Botox before I got just Botox. Yeah, I think that I did. Maybe like once.
For aesthetic reasons.
For aesthetic reasons, yes.
And then what made you
jump into
it?
When I was in PA school, I always kind of had a goal to get into aesthetic medicine. I actually had a friend who was a PA and worked in aesthetic medicine, and I loved what she did, and she told me she loved it, and I was like, "Ooh, I love this stuff. I love making people pretty and working an office job and doing this amazing stuff." And so I always, even in PA school years ago, I knew I wanted to do this. So I actually did all my elective rotations. We get elective rotations in our medical training.
Yeah.
You get to choose what you want to do and find someone to help, to do it. And I did all my electives once with her so that I could learn more about it. Yeah. And then obviously, as you know, I went into surgery first and worked in surgery. And then I transitioned to aesthetics.
How long was PA school? Is PA school?
2.5, a little over 2.5, a little over 2 years.
And what did you do your undergrad in?
Exercise science.
Very cool. So you start PA school, so from the beginning you were introduced to, what was this lady's name?
Her name is Holly.
Holly. Were you introduced to Holly immediately, or did it take you time to kind of swift through things and see what's interesting to you?
Well, I knew Holly before, so I already knew she was a PA working in aesthetic medicine.
I see.
Right. And then our training in PA school has zero aesthetics. Like we have dermatology and stuff, but we don't do any like we don't learn about Botox, you know?
Yeah.
We just don't.
So what are some other like realistic options you were considering?
Surgery.
Surgery.
Yeah.
It's
Yeah.
intense. And so did you have a rotation in surgical fields?
Part of our core rotations, our core education is 8 weeks of a surgical rotation. So my surgical rotation, I got a job with out of school. Like I worked there.
How was that? How was how's working there? In the
Surgery.
Yeah.
It was amazing. I was a surgical first assist. So a physician assistant first assist in a hospital. So I operated all day. Yeah.
In Fort Lauderdale?
Yep. In Oakland Park, technically.
Okay. And it was intense, I'm assuming, like long. When I think of surgery, I'm imagining like standing on your feet for 12 hours and
Oh yeah.
everyone being silent and
I did a lot
low-key
of
freaking out.
I did a lot of different subspecialties. So I did orthopedics, plastic surgery, general surgery, gynecological surgery, urologic. I did every sort of surgery. So some of them were like elective things that weren't very intense.
Mm-hmm.
And then some of them were like traumatic orthopedic surgeries that were very intense.
Did it change you as a person? Like seeing all that stuff in such a condensed period of time?
Yes. It
'Cause, right,
taught
like,
me. It definitely taught me a lot.
Yeah.
It taught me a lot. Yeah, for sure. It was an amazing experience.
Was it was the PA school, was it overwhelming at all? Did you feel like it was maybe even missing something? Now looking back on it, would you have wished they focused more on certain things rather than others?
All I remember about PA school is it was really hard.
Yeah.
It was a lot of training. You know how I describe PA school? Medical school, 4 years of medical school crammed into 2. So I did, 10 to 12 hours a day of school and clinicals, and that's all I did for over 2 years. It was a lot.
Yeah. And being in aesthetic medicine, is there a prerequisite like to be a qualified PA or some other minimum level of education?
Yes, you have to be a physician assistant, what I am, a nurse practitioner, or a doctor.
Okay.
To do what I do.
And is that specific to Florida or the United States as a whole?
So it is state dependent.
Yeah.
In a few states in the US, you can be a nurse. You just have to be supervised by one of us.
Yeah.
It has to be under supervision. Not in Florida, though. In Florida, you can't be a nurse.
I see. And what's the name of the clinic that you work in?
Right now, well, I work at 2, but my main clinic is InjectRx Wellness.
InjectRx Wellness.
InjectRx Wellness. InjectRx.
InjectRx Wellness.
Because we do injections
Mm-hmm.
and they do a lot of wellness.
Got it. So what's the wellness part of it?
They do peptides, hormone therapy, IVs, all of that stuff.
And are you involved in that stuff at all?
Minimally. I'm very busy with the other stuff.
Yeah. So okay. So the other stuff, we said Botox, which I keep forgetting the extended version of Botox.
It's a hard word.
Yeah, but we have Botox, and then so what is the other stuff? We have fillers, right? We spoke
Fillers.
about off air. So what is a filler?
Okay, so hyaluronic acid filler. That's what it is. It's hyaluronic acid synthesized into a gel. Okay, so it's completely different than Botox.
Serves a different end goal as well?
Yes, it treats different stuff.
Okay.
Mm-hmm.
Okay, so let's so do an example. Like
Do you want to see it?
yeah.
I brought some.
Yeah, let's see it. So we're seeing the actual substance. Ooh. Fun.
This is fun.
We have some goodies. So so I'm just trying to feel like when you say filler, I'm imagining filling up something. So
Yes.
if I have a dimple in my chin,
Yes.
are we filling up the dimple with something?
Beautiful example.
Yeah, thank you.
Beautiful example.
you.
So I think one of the most common things that people think when they think of filler would be like lips.
Okay, that's a good one.
Yeah,
Also,
making
one,
your
Kim.
lips bigger. Yeah.
Good example, Kim.
Yeah.
Thank you.
But we do it all. We do it all over the face. All over the face. Yeah.
Very interesting. Yeah. Okay. So I'm interested.
Okay. So I brought a little bit of filler.
What are you gonna inject me with some fillers?
No.
Oh.
Sorry for the. Hold on.
Yeah. No. It's cool to see.
Okay, I'm going to show you. Usually that has a cap on it, but I lost the cap, so just one moment.
So for those only listening to the podcast, we're bringing out some equipment, some filler equipment. We have a syringe. We have a large needle, a kind of large needle, no?
It's a 30 gauge, so it's small,
30
but it just
gauge
looks
needle.
big. Yeah, it's like a 30 quarter-inch. Okay. So this is a filler syringe, okay?
Yeah.
It's usually down there, but this one's like, my little leftover.
Yeah.
So this is actually what filler looks like. So it's literally...
It's like jelly.
It's
right?
like a little jelly. Cool, huh?
Yeah.
So this is hyaluronic acid synthesized. They synthesize it from different. It's synthesized by bacteria, and then they recreate it. They make it a molecule, so it's an actual substance, and it's used to fill areas of the face.
So literally, the filler literally fills up areas of the face, and also is it used for other areas of the body? Can be used for other areas of the body as well.
It can be. Yes.
And is that also something that came from, I don't know, the non-aesthetic medical field that was also brought in legally into the aesthetic profession over time?
So filler originally, now they use it for other things.
Yeah.
But filler it's an aesthetic
Oh,
product.
is it?
Yep.
Very interesting. Cool. So okay, so I gave the chin dimple example. You said lips. I should have thought about that one first because it is maybe the most obvious one. Also, if we think about it that way. But what are some other things that people come in to get filled to get filled up? That is not lips. That is not something as obvious as I said, like a chin dimple. So yeah, besides lips.
Okay, so mid face. So when I say mid face, I point to the cheeks.
Okay.
Like this area.
Yeah.
Now, a lot of this has to do with aging. So over time, one of the biggest things that happens is we lose volume. We lose fat in our face. And what we do with filler is we restore that volume loss.
So we literally lose fat, you said?
Yes.
When you get older?
Mm-hmm.
And what is that? So it creates like more some of a droopy face?
Correct. So we actually have these like fat pads. I love to show this, and I show this to all my patients.
Ooh, this is fun.
Yeah, so we have fat pads in the core areas of our face, in the cheek, under the eye, in the lower cheek, in the jawline, things like that. And they're all very full when we're young. Very full, and they're in place when we're young.
Yeah.
As we age, these fat pads, they shrink, they move, they contribute to skin laxity, they make the skin sag. They make it look asymmetrical, misproportional, things like that. So when we do things like fill the cheeks or even the chin, or the jawline, or sometimes we do the temples too. Those are all areas, core areas of the face that we begin to lose these things, the fat and even bone resorption. We have bone resorption.
Yeah.
So one of the biggest components of aging is volume loss.
Yeah.
So with filler, we try to combat that.
Aesthetically only though, not functionally.
Well, there are like functional. I mean, I would say, I wish I had a good functional
example.
really good
Because
functional
because
example.
again, when you're saying that, so I try and go to maybe an extreme hypothetical scenario where, let's say, you lose muscle, like a bicep muscle. So hypothetically, you could replace it with filler, but it's not going to maintain. You won't be able to have the same
So
strength.
you wouldn't have the function of the muscle. But aesthetically, that would be extremely advantageous for somebody.
Yeah.
You know what I mean?
Okay, so
Yeah.
so let's say so could I create the big, like an Arnold Schwarzenegger bicep muscle.
Nobody would do that for you, but yes. You
But
could.
yeah, hypothetically.
But hypothetically,
So
yeah.
you
You can.
So there must be if it's possible hypothetically, there must be people out there that have fake muscles.
Well, I'll tell you right now, they do like. I mean, I'm gonna just say this because this is something that I'm not trained in and I don't do, but it's extremely common. Penis filler. Yes, it is a thing. I'm not kidding. I'm not kidding, guys. It's extremely common, and I get. I mean,
I apologize for the foul language to our listeners. I'm just joking. Okay, so that's.
But I mean, that's like one of the things that, you know,
But is that
how
something-
far we can go with this product. Truly, you know, like, yeah.
And like Botox, is that something that needs to be maintained like every 90 days or so?
So filler is actually, it lasts a lot longer. So a lot of these products last up to 24 months. Most last up to 12 to 18.
Yeah.
So they do last a long time. And it's more of like a decline, a slow decline, like an exponential decline. So like your body metabolizes it at a healthy rate. It's not like it's one day just disappears.
Yeah.
It's like a little bit
You'll
gone
notice
at a
it
time.
going,
You'll
yeah.
notice it kind of going down. So you don't just like, you get your lips done and they deflate one day. It's like they slowly
Or your
go
penis.
down. Or your penis. Exactly. Oh, people put it in the butt. They do. They put it in the butt.
Oh wait, so is that like the Brazilian butt lifts?
Well, a true Brazilian butt lift is surgery. It's fat transfer.
Oh, okay.
But people don't like to go under the knife, so they get filler. Yeah.
So you could design like the perfect backside with filler.
Exactly. Yes.
Wow. Okay. Commonly people come in for fillers. Also in the face areas, we said. Lips is a big one. So even the lips is something that people also will last for a long time, and people will start noticing a decline in.
Right.
But what is it? You know, I'm trying to avoid using the word puffiness. But like the
Voluminous.
What is it?
I say voluminous.
It's a good one. Better than mine. Voluminous. So when you start losing that
The volume.
When you start losing the volume of your lips, then you'll come in for more.
Yeah, and then people will come in for more.
What are some contraindications for Botox and fillers? Like when are you like, no, sorry, ma'am, or sorry, sir?
So sometimes people with connective tissue disorders like scleroderma and stuff like that, I make them get clearance before. But that's literally the only contraindication. Yeah. There's no allergy to hyaluronic acid filler. A lot of them have lidocaine in it, so we always make sure you don't have a lidocaine allergy.
Why is that common though? A lidocaine allergy?
No, but it is a thing.
Okay.
It's not like super common. Yeah. But there are allergies to lidocaine, yeah. So most of the products have lidocaine in it just for comfort purposes.
Yeah, I'm just asking because like you know, I come to get administered with some filler from you. I wouldn't know if I'm allergic to
lidocaine.
Yeah.
Yeah. So we have topical numbing cream with lidocaine in it. So we would test. We always put numbing cream before anyway. So if you were to have some sort of reaction to the lidocaine, I would say, are you allergic to lidocaine? If you didn't know, then I would proceed with a filler that didn't have lidocaine in it, because they do offer fillers without lidocaine.
Yeah. And so what did you say the main? So besides that, what was the other main contraindication?
Pregnancy.
No, we said okay. So why not why pregnancy? How
There's
does that
just
come?
no we don't have any testing on especially the botulinum toxin, like the Botox. It's contraindicated in pregnancy because everything's contraindicated in pregnancy. In my opinion, there are no aesthetic or elective procedures to be done while you're pregnant. You just don't, you know.
No, yeah. Okay.
Because it's obviously we don't test this stuff on pregnant people. We just don't.
Yeah.
So 9 months. Sorry, guys. I have people who, the moment they have their baby, they have an appointment with me because they just went 9 months without getting anything done. Yeah.
Wow. Someone was telling us that, that breast cancer pills are tested on men because more men sign up for studies than females.
Really?
Yeah. Isn't that interesting?
I mean, yeah, that makes sense.
So yeah.
Whoever's willing to test. Yeah.
No, so I guess it makes sense if we just don't know, right? We just don't know what the effects are on pregnant women or.
And again, most things in pregnancy, like they just say don't do it because
not worth the risk.
They're never gonna do these companies that make these products are never gonna do clinical trials on pregnant women for something that's not
Yeah.
100% necessary.
Yeah.
Even if it's medically indicated, like for migraines and stuff like that, they haven't done it, and I don't think they ever would.
But what was that other contraindication you said? Some issue with the muscles.
Oh, like connective tissue disorder,
okay.
like a scleroderma. Sometimes they have problems with connective tissue, so we don't like to freeze the muscles.
Okay.
Yeah.
But because something it could be causing damage versus helping.
Yeah, like if you already have something going on there, why would we take a toxin and freeze the muscle if you already have a disorder in the area of where the tendons meet the muscles, things like that.
Yeah.
More often than not, they go, yes, I've seen my immunologist, my endocrinologist, whoever they see, and they're like, it's perfectly fine, give me a note, and then it's totally fine.
Yeah.
Yeah.
So generally, in terms of any potential contraindications, so if you get like the okay from their whatever expert in whatever issue that they have, they sign off that they can do it, then you go for it. And have you seen things go wrong? Like I know you said we're better at it now. Things are better. It's obviously legal now, right? By the way, is it legal in most countries?
Oh my gosh, yes, extremely legal. We're behind. The U.S. is behind
is it really?
when it comes to that. Yeah.
It's interesting. Not the only thing, but have you seen things go wrong like so far in your career?
Well, so there's always risk to any procedure.
Yeah.
Like a risk of Botox would be like, I'm poking you with a needle. You could have a hyperinflammatory reaction at the injection site.
Yeah. Nothing to do with the Botox, just the injection.
Not really anything to do with the Botox.
Yeah.
Yeah. Some people will get like a mild headache sometimes after administration of Botox. It's a known side effect. It's like less than 1% of people, Other than that, there are no major, serious things that I look out for when it comes to Botox.
And so if we injected now, I know we're not going to, sorry, but if we did,
I wish.
If we did inject between my eyebrows with some Botox, but because you're also saying that there's no real risk, assuming that nothing sparks up on the day, maybe I'll get a headache or something like that. But there's no risk because my body will metabolize it slowly in the right amount in a healthy way over time and just get rid of it.
Right.
Of any toxins that we put into my body.
Exactly. I can't reverse it though. You had asked me that.
So you can't reverse it.
It's not reversible.
But we can't reverse it, but my body will reverse
exactly.
My body will reverse that for me, right?
Your body reverses it for you. It just takes time.
I know. Also, online, I always see these things. I know I'll talk about toxins coming into your body through nutrition and through what you eat or drink. I see, obviously, there's a lot of people out there that are saying you shouldn't even a plastic bottle like this has so many toxins in it, or if you drink a Celsius can, or if you drink a Diet Coke, all these different things have so many toxins in them. But then I also follow people on the Instagram, YouTube world that say that because the toxins are in such a small amount, your body just easily metabolizes them and it doesn't affect our bodies.
Do you read that about plastic bottles? Because I always worry about those.
That's what I hear. Avoid them at all costs, but here we are. So do you hear that?
Yeah.
It's been on your mind?
Of course.
No, it's that's what they say, and it kind of makes sense to me because these are delicious. Aren't they delicious sometimes? The water bottles?
Well, it's plastic.
I know. So anyway, but the less cynical people in our world, maybe they are right, say that it's such small amount of toxins that our body is just able to handle it, get rid of it, move on, and reverse the damage that's been caused. And in your case, the body will reverse the damage in quotes, but still maintain no creases on your skin at the same time.
The biggest thing about botulinum toxin, botulinum toxin, yeah. Neurotoxin, that's an easy word to say.
Yeah, that's easy.
Neurotoxin.
Yeah. So does the botulinum toxins fall under the category of neurotoxins?
Correct.
Okay, so I'll just stick to
neurotoxin. Yeah. So the biggest thing about neurotoxin is they have curated it. The product that they make is such a minuscule amount. We have found the exact dosages to be used safely in each area that
Yeah.
don't cause any severe toxicity.
And do the dosages change based on area of the body?
Yes.
Do the dosages change based on men versus female, but the same area of the body?
Yes.
Do the dosages change on whether it's the same area of the body, but male 1 weighs 150 pounds, male 2 weighs 250 pounds?
No.
Mm.
Okay.
Okay.
But if he's super, super, super muscular and has these big giant, let's say we're treating the trapezius, the traps for migraines. Let's say he's got some big old traps. I'm going to have to use a ton, like a ton of product to be able.
Because it's the muscle that's big.
It's
but
the
if he was
muscle
super
that big.
fat,
It would not matter. Because that's how it doesn't matter. The rest of the body doesn't matter. Systemically, metabolically, all of that does not matter. It's the muscle.
And from based on what we know of, the nerves that are trying to connect to the muscles are not affected by this.
Not long term.
Just that.
Just
they're
while
basically
the product is
sit on the bench for a bit.
Correct. That's a good way to put it.
Thank you.
They just step aside for a little.
Yeah. No, I always like my soccer analogies or sports analogies. So we have Botox, we have fillers. You said other stuff. What other stuff are you busy with besides those two? Or those are the two biggies?
Those are the biggies. That's my expertise. Botox fillers.
Yeah. And in terms of continuing education for you, is there anything that you really interested in developing, learning about in this aesthetic medicine?
Well, my job is very technical, like learning different techniques.
Yeah.
Mastering the face.
So you want to master
angles.
techniques within administering Botox, for example?
Mostly fillers. Botox too.
Because you mentioned the technique that you use for the face where you sprinkle, I forget for what it was specifically.
Sweating
from the face. You sprinkle in all different areas.
That would be a different technique than me. Exactly. Yeah.
So is it, could someone like yourself, you or someone sitting wherever in the US, is it something that you can come up now with a new technique, Kim's technique for fixing sweating in the face, because you found a new way to administer Botox in different areas of the face that can really have a positive effect? Or the same thing for teeth grinding or for TMJ with the things we spoke about? Yeah. So is that something that you can almost come up with or learn from someone that has done that before?
Absolutely. And again, there's FDA approvals for this medication. It's a medication. So the FDA is, it's only approved in certain areas, but in our line of work, we use it in other areas. You know what I mean? So it's not FDA approved even for the trapezius, but neurologists use it in the trapezius. It's things like that. So people as injectors like me are constantly coming up with new areas to treat that are safe and doing trainings and teaching other injectors around the world, things like that. So that's there's a lot of continuing education out there. I constantly do trainings in the area, especially in South Florida. There's a ton that injectors come and they teach different techniques that they've discovered or they learned or whatever that's becoming more popular. Yeah.
That's and it's something you have to do as well, no? In terms of continuing education for your profession?
For my license, for my profession. Yeah.
Yeah.
I mean, I do it for my expertise to get better at what I do. But I do literally have to log CMEs to renew my license.
Yeah.
But I can do that in anywhere because as a physician assistant, I'm trained in all realms, all scopes of medicine. So I can do my CMEs and whatever I want. But I just choose to do them in aesthetics because I'm actually I want to actually continue my education and get better at what I do.
Yeah, and you said it's an evolving,
extremely evolving
profession, evolving science.
Oh, definitely
around it as well.
Mm-hmm.
And are they studying these things more? Are they trying to look at more effects or more different ways these things can even be more efficient, better?
We haven't even tapped the surface. I'll be honest.
I
think that right now is when things are exploding in this field, and it's a beautiful thing. It really is because. Don't even get me started about the U.S., how far behind we are. But just because in general, our FDA approval process is very hard. So it's harder for us to introduce a lot of different products in the market and a lot of different areas to treat and things like that. But in other countries, the UK, Korea, all of that, they're doing some incredible things with with these products.
Like, do you have examples of what things that are maybe still illegal here to do? Or-
Yeah, and I mean, like a good one is like people are using hyaluronic acid filler now as an overall facial skin rejuvenation instead of just volumizing. They call it like skin boosting, and so it actually attacks the dermal layer of the skin throughout your whole face. Instead of me taking hyaluronic acid filler and filling the cheeks or filling the chin or filling the lips or something, they're actually using a concoction of hyaluronic acid filler and a bunch of other stuff in it to make the skin like just look overall newer and cleaner and younger and fresher. And we don't even do that here yet. And they've been doing it in Korea for like a long time. Not a long time, but like the results are amazing. It's amazing in the world of anti-aging. You know, like the Koreans are going to look 22 until they're 100, I swear, because they're so advanced in aesthetics. It's really cool stuff. Really cool stuff.
Yeah, I saw that they changed some law in Korea recently, that everyone's age changed overnight. They now they count someone's age is from the moment that they were conceived, not from the moment they left their mother's bodies.
So you're going to tell me I'm already 30.
So pre-birth, yeah. So everyone would be a few months older than they are already. And I only know that because in the world of sports, age is very important, because someone's value will be lower if they're 30 versus 29, for example.
Yeah.
So it's an interesting one. So they so even though some of their ages they've become older, they do have these different ways of looking younger. So you think it'll keep getting better here as well, that people keep supporting? Yeah. So you feel like you're in almost the right space, because there's so much that'll be thrown into it in the next coming decades.
I think that this is never going to go away. It's only going to get better and better.
And you don't think that like you think we'll see less and less of those sad cases when you see like an old lady walking on the street and her face does not look right.
What's very interesting about my job, honestly, is I really am at a point. I'm in this weird medium between like a lot of the older celebrities, and I use celebrities because those are the people that are in the public eye. So somebody like you who has no idea what any of this stuff is, the first thing you think is, "Oh my gosh, that's crazy! They look insane."
Tom Cruise,
right? So I'm stuck in this generation of and Madonna looks great right now, but like, for example, like when she looked like that after her surgery and she looked totally crazy, like those older celebrities,
Who's that? Which name did you say?
Remember when Madonna looked really crazy?
Oh, Madonna.
Yeah. Yeah. She was post-surgical though. Yeah. That's a whole other conversation. But so there's that realm. And then you look at the Kardashians, and we're right in between that like very fine line of people really believing in this stuff, because there are still celebrities walking around looking crazy from all the work that they've got done. But then we have the emerging celebrities that are getting into their older age. Kim Kardashian is a great example. She has everything done in the book to her face, and she looks amazing. Like nobody would ever look at her and be like, she looks crazy. She has so much work done. You know what I mean? Like her and the whole Kardashian clan in general is a really good example of the future of aesthetic medicine. It's not just looking crazy and overdoing your face. It's anti-aging, it's looking better in your skin for a longer time,
which I think is good overall. Can I say where it scares me a little bit?
Yes.
It scares me a little bit is, okay, so we look at Kim Kardashian. The science, the aesthetic medicine practitioners, her money, figured it out. Looks great.
It's got a down pat.
Aging, superficially, is solved, let's say. But internally, what's going on internally, we have no idea. So if she, let's say, we're just using, sorry, Kim, other Kim, but if we're focusing on Kim Kardashian, if she... Again, she's focusing on fighting aging as long as she can, superficially. If someone's focusing on that and not on fighting aging internally,
then there's no point.
But there's some like maybe there's no, maybe for some people there are, like maybe, you know, maybe someone's happy
No,
to.
no, I'm like, that's a big part of what I do, is that if you're taking care of yourself and all you care about is the way you look, like, it does not matter. You know what I mean? Like, you have to be taking care of yourself internally. And a beautiful thing about my patients too is a lot of them do.
Yeah.
I think that a reflection, and this is just my opinion, I think that most people who take care of themselves externally, it reflects on the way they take care of themselves internally. You know, like, I think that it's just another expression of an appreciation of your body. You know, like, a lot of people think that this is vain, and Kim Kardashian's very vain, and maybe she's just an example that we use, but now I feel like she's like a bad example because I don't really know if she takes care of herself internally. Let's use me, okay? Let's use me, and I'm just a regular person.
The other Kim.
I'm the other Kim. I'm a regular person. Like, I take care of myself.
Yeah.
Metabolically, I exercise, I eat right. I care so much about myself on the inside, and the outside, obviously. And I think that my reflection of my appearance and my skin and my Botox and my fillers and me just caring in general really reflects on how I take care of myself on the inside. And of course, there are exceptions. Like, I have people who like could not care less. They also like they'll come in and get Botox and they smell like cigarettes, and like, you know, there are those people. But in general, the people who are treated and that I treat are a healthy, extremely healthy, on the healthier side of the population, definitely.
Yeah. Which again makes sense to me.
Yeah, right.
And I think I would generally agree, because when you see someone that washes their face, gets a haircut, clips their toenails, I think they're more likely to, you know, be healthy internally versus someone who doesn't clip their toenails, who doesn't get a haircut, who doesn't wash their face.
I feel like they go hand in hand. I mean, they go hand in hand, which of course not always, but they tend to.
But I'll finish on what scares me.
Okay, go.
No, it's because, and I'm the only male sitting here on the table. But you know, like, when you see what we think the stigmatized TikTok girl, you know, the filtered TikTok girl, there's this fear that sets an unrealistic expectation for other girls, other females, other, you know, young girls growing up. And I think, by the way, it's very similar for men, but it's not as popular to talk about. So we'll stick to the females. So I just think that, okay, so a girl is on TikTok all day. She's unhappy with her state of mind. She's unhappy with her face. She's unhappy with her body. She sees these perfect human beings. And then there's kind of a solution lurking in the background, because that girl who's unhappy with her face, unhappy with all these things, can go to an aesthetic medicine practitioner and try and bridge that gap to be as close to the TikTok person as possible. That's a fear I have.
I mean, that's completely rational. It's very much happening. But I think that, I mean, I what's really crazy is I get like 21-year-old girls coming in and showing me a filtered photo or a filtered TikTok or whatever, and being like, how can you make me look like her? And half my job is being like, I can't. It's not like that. So I agree with you. I do think that is an issue. And I think that's more, I don't want to blame it on social media, but I think social media is probably the biggest culprit of that versus this kind of stuff. You know what I mean? Like, I do. I mean, especially in my line of work, social media is a serious problem. Filters are a serious problem. The aesthetic image that people give off on social media is a problem, especially in younger women, like Gen Z girls. It's very tough for them. Unrealistic expectations, you know, things like that. Unrealistic expectations for themselves aesthetically. Yeah.
Do you get Botox fillers?
Yes, absolutely.
But is it something you can administer on yourself?
No.
So do you go to Holly?
No, I don't go to Holly anymore. Love Holly. Love you, Holly. I go to a colleague. We work in the same office. Yeah.
Easy.
Yeah.
Easy. But it's not something like, have you done it to yourself? I'm just wondering if it's something you can almost like.
So I do my own Botox. I can't lie.
Yeah.
Because it's easy. Because it's.
Are you not supposed to?
I mean, no. People do like all their own stuff. It's just obviously it's like safer not to poke yourself with a needle. But I can do my own Botox. It's really easy. I'm so good at it that I'm just like, it's whatever.
Yeah.
My own filler though I don't do. I only have someone else administer that on me.
And so so in other countries, like you said, we were in the US, maybe we're behind other countries in terms of getting things cleared, in terms of getting things out to the market. So in other countries, is that something that people can just like order online, a Botox kit for the middle of their eyebrows and just be in front of the mirror and do it themselves?
No, everywhere it has to be administered by a licensed professional. You can't just do things like that. It like even in the UK, I think that you can you don't have to be a nurse or a doctor, but you do have to go through they have a specific training
For it, yeah.
for aesthetic professionals. Yeah.
And you see clinics all over the place, like beauty clinics.
Everywhere.
Yeah, everywhere.
Yeah.
Really everywhere.
Uh-huh.
And in your clinic, is there anyone there that practices any form of like facial rejuvenation, facial gua sha modalities, or all these different things that people, or even acupuncture for the face?
Not at mine.
Yeah.
But yeah, there are clinics that do that.
Yeah.
I'm sure.
Oh yeah, I'm just wondering if at yours as well.
No.
So you do play with it yourself, and is it something you can practice? Like if you are one of these people that you think that you discovered this amazing technique for administering Botox into a certain location, how do you practice? Like, can you practice? Is there any like a dummy, or
okay?
How do you know? How do you know without
practice.
trial and error on a customer?
So okay, like when we do our original training, when I would practice on cadavers.
Ooh, okay.
Okay, and like that would be like for filler and stuff, and that would just be for administration technique. And that's like when you first learn, or if you're doing advanced training and like a masterclass training or something, then we practice on cadavers. And that's just to get the actual techniques down without like, going on a patient being like, oh, let me just try this. Yeah. As far as, yes, it is trial and error with patients. Like if I try a new technique or something, I'll do it on a patient. I'll be honest, I usually do things on myself before someone else. Yeah. And it's never anything crazy where like it's going to be potentially harmful for someone, you know what I mean? But it's just like, I'll try a different technique for lips or something like that, where it's not like going to botch you or hurt you or anything like that. It's just like a different technique. And, or coworkers love to come to me and they're like, ooh, try that on me. Yeah.
And in school, is it something also that like amongst people you practice on each other?
Not what I do.
Yeah.
Remember what I do? We didn't do a lot of this stuff in PA school, like in school.
So when you finished PA schools, you did your different elective cycles with Holly, you said. So was that your practice period in doing these things, or did you have to do it like after PA school? Did you have to do some other sort of qualifications?
Yes, I had to do a lot of outside training outside of school. Like I had to do to learn. I did. I had to do a lot of outside trainings, and then I worked at a practice where I had a mentor. He was a nurse practitioner and he mentored me for a while and I learned from him.
How did you connect with him?
I got lucky. I had a friend of a friend who was like, we're looking to train a new injector. I know you want to do this. And I was like, let's do it.
And are there many males in the profession of aesthetic medicine?
There's a lot of male injectors. Yeah. Men love it.
Do you ever inject your husband?
He gets Botox. He does. He gets Botox. He only does the crow's feet, the eyes.
Do you make him, or does he want it?
So at first, the first time he did it, I made him. He was like warming up to the idea, and he was like, all right, like finally like was like, all right, if you want to do it, I'll do it. I'll try it. But he loved it. He did. He loved it. But it did take him some convincing.
Yeah.
Yeah. It was like one day, because he thinks that men age so much gracefully, which is true. And he thinks that his wrinkles are going to be cute on him for the rest of his life. And I'm like, I promise you, they are not.
No, I think mine will be cute for the rest of my life.
Most men think that. And then they come in when they're 45 and they're like, what happened here? And I'm like, you didn't get Botox when your wife told you to. And so one day John like looked, I'll never forget when he finally said yes. And he was smiling and he looked at his crow's feet and he was like, so if I did it, would those go away? And I was like, yes. And he was like, okay, let's try it.
Maybe you were slyly brainwashing him.
Maybe I was.
Over time.
Yeah.
To pay attention to his wrinkles more.
Just sprinkling it. Yeah. It worked.
That's awesome. All right, so let's do a little activity, if you will. I came into you now for a consultation. Preventative aging.
Okay.
So I'm assuming, can you see lines on my...
Yes.
Here's a question for you. I have these like scars on my forehead.
What are they from?
From chicken pox.
No way.
From scratching. Yeah.
Oh my god.
Well, that's the information I was fed from my parents, at least. That when I was 3 years old, I had very bad chicken pox, and I scratched it.
It might be real because I have them on my back, and my mom says they're from chicken pox.
I have them on my back too, a couple of locations, but these are the most visible ones. Just out of interest, so like, could filler fill these in?
So yeah, they can. They can. When it comes to scarring, it's it just depends how much your scar has hypertrophied beneath the dermal layer. Filler only goes so far. That's pretty much like what I would tell you if you came in for a consult as a patient.
Okay.
You know, I would say like we can see what we can do, but really for scarring, we really like to do other things that attack the dermal layer of the skin, like resurfacing, like microneedling, skin care, things like that. Not so much filler.
I see.
Yeah. So that's why I'm like really familiar with other skincare, with other things for skin in general, because a lot of people come to me with things like that. And I let them know that what I do is not indicated, but my office will offer it. Or if they don't offer it, I refer them. Yeah. Like laser, you could do lasers and stuff like that. A lot of other things. Yeah. But filler only goes so far for that kind of stuff.
Okay, so you can see the lines on my face, like when I make expressions. I have the same lines. Are these the ones you're talking about?
Yep.
So, what should I do?
Okay, so
I want to prevent my external aging.
So what I would tell you is I would go.
And I don't want to be the 45-year-old coming in and you telling me it's too late.
It's too late, right?
So here I am, a few years early.
So you're in a great spot because just looking at you, you really don't have a whole lot of static lines. Like they're very minimal. Now I can see like maybe a tiny little fine one right there. Like you're at a really good spot to start with Botox. So obviously when you make an angry face, like you're squinting, be squinting. Yeah, see all that musculature and you're making those lines. And then you have even this like vertical, everybody hates this horizontal one.
It's a strange one.
Yeah. Not everybody gets that. A lot of people do. This line, raise your brows. You're going to start seeing that middle line right there. In maybe like 5-6 years or so, those are going to start getting etched into your skin. And they're not going to go away ever. So what I would do today, also the eyes, the crow's feet. This is a big one for aging. Yeah. I would do a full treatment of either Botox or Dysport, which is the botulinum toxin, the neurotoxin. And I would treat right here, very light treatment right here just to soften the muscles. You'd still have movement of your brows and stuff like that. You'd still have your expressions.
Yeah. So is that the thing? Like if we did, for whatever reason, we made a mistake, we went too far, is that a potential side effect? If you go too far and the person administering gives too much to certain locations, like you lose ability to...
Yes. So one of the biggest like side effects, quote unquote side effects or quote unquote complications of neurotoxin would be a misplacement of the neurotoxin. And it can do things like you lose the movement of your eyebrows.
But also that's temporary because your body will metabolize it.
It's all temporary, yeah. It's just, to not move your eyebrows for 3 months is like really crappy. And that does happen. It does happen, yeah. If let's say you went to an inexperienced injector or maybe like you're not supposed to sweat after administering Botox because we don't want the product to move.
Yeah.
Sometimes it can diffuse a little too far and things like that. Or, if it's placed too low in the forehead, then yeah, your brows will almost go down like this. And then you won't like it.
So I interjected you there. So you're saying about me. So you would say I'm the perfect place to start. You'd inject these different places.
Yeah.
And then every 90 days, I would come back.
Yeah. So what I say is that the manufacturer says that this product lasts for 90 days. Okay. It's highly variable with each individual. I have some people who come back every 5 months,
Yeah.
Sometimes people go even 6 months. You'll find, let's say you're the typical patient and you last 3 months, you'll find at about 2 months that you have like a little bit more movement, maybe one tiny soft wrinkle. And then at 2.5 months, you'll be like, oh, I see a little bit more wrinkles. They're starting to come back. And then at 3 months, it will be back. You'll be like, oh my gosh, I need it. I haven't had it in 3 months, and then you come back and then you get a full treatment. So It's not like one day you wake up and everything is back. It's kind of like slow.
What would be your recommendations for someone listening who maybe feels like they need to get some Botox or some filler for whatever reason? Maybe it's teeth grinding, or maybe it's something else, or maybe it is the line between their eyebrows. But what are the key things you think to think about before stepping into someone's clinic? Because like any profession, you could step into a clinic and it could be a great experience, or you can step into another clinic and it can be a crap experience. In any form, I think, of medicine or anything that we also here on the podcast that we talk to people, the courses that we do, it's very easy to fall into the wrong hands of someone. So what would you recommend based on your experience for someone, that's not in Fort Lauderdale and that cannot make it to your clinic?
I was about to say, well, go to me. No, I would say always look up your provider, and the office that you're going to, the medical office that you're going to. And then, a lot of medical offices have more than one provider. So always find out who you're going to be treated by, whoever they schedule you with, and then ask for like their credentials would be a good one. But also a lot of people in this field, you can look up their reviews on the office, like Google reviews, and look up their name. A lot of them have portfolios on their Instagram. Look at their work, make sure they have a lot of work, a decent amount of experience, things like that. A big thing that I always say is word of mouth. Like if you have a friend who has done it before and they like their provider, go to that provider. Don't just go to any random person. I would just like any,
Yeah.
Just like you have an issue with your knee and you're like, I really want to go to a really good orthopedic, something like that. Like you want a recommendation, like things like that. You want to know they have good reviews, like things like that. Same thing.
Is there, and you want them to be qualified at a certain level, or that I know you said legally they need to be.
Legally, yes. Yes.
But again, are there charlatans out there who are opening up? So you want to, so you want to make sure that your caregiver is qualified.
Yes. So you want to get a big thing about this field, and a lot of fields, obviously, in general, is you want to find a licensed provider who's licensed in the U.S. Not that they, because people get licensed in other countries and then they come here and they practice. It's illegal. I'm sure that they're good at what they do, but they're also probably using a legal product. That's the biggest thing.
I see, because they need
the legality. They
are
probably illegally receiving the product. Yes, and obviously you want legal product like that's coming from the U.S. and FDA approved, and it's not expired, and it's being obtained in the correct way.
So, does the product expire? Does it have a shelf life? Yeah,
it has a shelf life. I think 2 years usually, most of them.
Because I feel like an important piece of it, because if you're a clinician and you have product on the shelf expiring,
you have to use it.
You have to use it, right?
It's expensive.
So that's why another reason to find the right people, because, and I think it's an important note, and again, only as respect to your profession, is that it might be something that you do on a daily basis, and that seems simple, but things can go wrong. Like you need to know what you're doing, and you have to be, I think you said it a few times, like super specific. Like you're super specific about where you're applying these things, administering these things. So people do need to be
careful who they show up, who they
Very
trust, right?
Yeah. I mean, there's safety implications for a lot of the stuff that I do. Like there can be emergencies, especially with filler. There's the vascularity and stuff. There could be occlusions if someone's injecting and they don't know the anatomy. Like I know facial anatomy like the back of my hand, you know, and if you go to somebody who doesn't, you're more at risk for an emergency, for sure.
Price-wise, is there much variation between different clinics?
Yes, absolutely. We'll talk about different countries.
Yeah.
A lot of the reason why we're so behind on what we do is because due to our FDA approval process and our clinical trials and all of that, which I don't hate on it because we're really into safety. All of our stuff is extremely, extremely expensive. Like it's very expensive to get this stuff done.
Yeah.
Versus like in the UK, Korea, and Colombia, and all those other places that do a lot of this stuff, it's pretty affordable. Like getting like a full face of Botox with me is like upwards of over $600, you know, every 3 months. It adds up. And I think in Colombia you can get it for like 150. It's really nice. But yeah.
And that's not the only thing. I think I see even celebrities like go to Colombia and go to Mexico for different treatments of like stem cell injections and different things like that are not legal in most places in the US, right? Yeah. All right. Well, look, that was an amazing crash course for me personally on neurotoxins, on fillers. It is super interesting. Again, just because of the stigma around it, it's so easy just to think about it in terms of, you know, voluminous lips or voluminous cheeks. But I think it's definitely something that should be, and people should think about, just look at it through different perspectives, different angles, and not just superficially.
One thing I like to say is it's not just about vanity. You know, a lot of my job and why I really love it so much is, and it's silly to say because some people think I don't change people's lives. I have had so many patients, especially older patients, who they don't recognize themselves in the mirror anymore because aging is really, really hard. It can be really, really hard. And when they do this kind of stuff, it makes them feel better and it helps their mental health and they feel beautiful. And, you know, that's another intrinsic thing, mental health. This stuff is really important. You know, not everybody cares about the way they look as much as other people do, but when it comes to aging, it can be tough, you know, and women, especially, like women have a really hard time looking at themselves in the mirror once they get to their 50s and they remember themselves when they were 25 years old and they're so stunning and beautiful and have these full faces and whatnot. And then you get to 50 and you have all these wrinkles and they're just like, I don't know what happened, you know, and I really help people with that. I mean, I really do change lives in that sense. Like I have people I've been working with for years and they just have told me how much of an impact I've made on them and their well-being. So it must beautiful. Feel good. Yeah, I love it.
Is there anything we didn't learn enough about in this crash course? Yeah. So Kimberly, California, thank you very much for being here. I don't know when I will do my first Botox / filler experience, but I will. And my first one will be hopefully in your hands.
Yay!
So it made me. So I'm glad your husband was the test run before I step in. But I'm definitely more open-minded to it. I'll definitely think of ways. Again, maybe I'll regret this in 20 years, but I'm not very self-conscious about my wrinkles, even my scars on my forehead. But
they're beautiful.
But maybe I'll regret that in 20 years.
You don't need anything. Yeah. And that's what I tell everybody. I'm like, you don't need anything. You're beautiful, but I can help if you want.
But I guess then people get it anyway because they want the impact.
Sure.
They want the impact, and I do like the fact that it's not like a permanent change. It's not plastics. You're not getting plastic surgery where you're changing something forever. But it's almost like a temporary tattoo.
Yeah,
type thing to test something out.
Yeah.
But with potential benefits for the future.
Exactly.
You know, mitigating you looking back 20, 30, 40 years and saying, why didn't I listen to Kimberly, California, in 2023. So look, this is episode 30. This was a unique one in its own way, because again, we've never spoken about aesthetics, really. You know, we are focused on maybe specific injuries or recoveries or rehabilitations or different medical professions out there, or therapy professions. So it's nice to see the therapy perspective of an aesthetic medicine profession. So it is super, super cool. So I appreciate you coming here. I appreciate talking to you, and I am very happy I learned more about this, because it was always something that I just have my preconceived notions over, and really arbitrarily, there's no reason why, just based on those movie clips you see, or just what generally people talk about,
Right.
or the again, the sad cases when you see a 72-year-old woman on the street walking and something looks off about her face. So you did say something in the beginning that I forgot, that you said that from now on I will focus more on. You said that you, as someone who administers, you're always looking at people's faces for something. What was it? Or am I imagining?
I always look at people's faces to see if they need Botox?
Is that it? I thought you said something else about. I thought you said something.
I don't know if I said that, but I do that.
You do that? Yeah. Well, I bet you do. Okay, so do you look at it also from the perspective with someone that has got Botox, you can see it, or fillers, you can already see that they've got the work? Like, is it more obvious to you than it will be for me if we're looking at someone?
Yes.
So if someone has got it, in quotes, done well, you might spot it, I might not.
Right, and I might not even spot it. If it's done really well, I mean, like, when it comes to Botox, yeah, I can pretty much tell if anybody has Botox, because, like, I know. But the average person should not be able to, like, really tell.
Shouldn't be able to tell.
Yeah.
But, and no pun intended here, if I spot a 70-year-old woman and her face is beautiful, then I should still raise some eyebrows. That was the pun. Raising the eyebrows. But I should raise eyebrows. No, if I can assume that if she's 70 years old with no lines on her forehead.
Exactly. You can assume.
Even if everything looks right.
Probably a facelift though.
Right. No,
70?
sometimes I see like older women who are, late 60s, early 70s, and I'm like, they look amazing, and I don't know what they've gotten done, but I know that they have a lot done.
So I don't think so I don't think we spoke about facelifts. So where does
surgical?
Is it? So it's
surgical.
Facelift is surgical.
Yeah.
So what is that in short? What does that process look like?
So it's
I hope it's not what I'm imagining.
So it's probably worse. I used to work in surgery, so I used to actually assist in facelifts. Facelifts is really when they take the muscles, the tendons, and the skin, and they surgically remove the skin, and then they tighten the muscles and the tendons. So that's not something I do. Like, not even close.
It was like screwing a screw of the face, like just making it tighter.
It tightens everything. Yeah. So there gets a point when you get to a certain age where your skin is so loose just from aging, loss of collagen, all that stuff, and volume, that like no amount of filler or anything like that is going to help you. You have to actually take the skin and the lax muscles and things like that and surgically redo them, if you will.
I see.
Yeah.
I see. So what I was imagining was worse.
Oh, okay, good.
I was imagining like cutting open the top of the forehead and literally pulling the skin.
Oh, that's what they do.
Oh, that's what they do?
Yeah. Yep. I was just doing it in a non-graphic way.
Oh.
But that's literally what they do, yeah.
All right. So look, super interesting. Thank you for bringing the equipment. Thank you for the diagrams. For the people that weren't watching, we had some cool stuff out here, and
I'm not looking at
and hopefully after I get one of these modalities administered to me, then we'll do a recap and I can tell you how my experience was.
Yay. Thank you, Danny. This was wonderful. I had such a great time.
Super fun. Thank you very much.
Fun. Thank you.
If you liked this video and you want to see more, make sure to subscribe below and don't forget to hit the notification button.